Thanks so much for joining us today for a presentation with Kristin Glumack, who will be sharing more with us about her work on implementing first aid education in the Minnesota Amish community. And so I'd like to begin by thanking Andrea Waxmansky, an integral member of our scholarship committee. She's the one who manages the technology to make this event possible. So we're incredibly grateful for that. And if you're joining us for the first time, we'd like to ask that you save your questions for the end of the presentation or put them in chat. And Kristin is going to be speaking for about half an hour, and that should allow us plenty of time for questions and discussion afterwards. And if you do participate in the conversation after the presentation, your questions and comments will be recorded. And those recordings will be available to our members on our website. And you can check that out, as well as access previous cafes if you're interested at amishstudies.org. We also have a list of upcoming talks for the rest of this academic year available there, so you can get those and put them on your calendar and hopefully join us for some of those. If you're joining by phone, you can unmute by pushing star and the number 6. And without further ado, I'd like to introduce today's speaker, Kristin Glumack. Kristin, thank you for being here today and sharing your work with us.
Thank you.
I'll
give a little bit. Hi, everybody. Thank you so much for having me. This is an amazing opportunity, and I will be the first to admit I'm a little nervous, so hopefully it goes okay. It actually was really helpful to hear kind of the backgrounds of the individuals that are here today and kind of where their work is being done. So I'm excited. Technology is not my forte, but I think we're going to make things work. We'll get through the next half an hour and kind of go from there.
Kristin, let me jump in and introduce you to everyone.
Oh, go ahead. Sorry, Corey.
So I came across, before we jump into Kristin's presentation, I wanted to jump in and just say that I came across Kristin's dissertation recently, and it's just really fascinated to learn about the work that's going on in Minnesota, bringing health resources to some of the Amish populations there. Kristin is currently a nurse practitioner working with Alina's Health's senior care team, providing care for geriatric patients in transitional care units in Minneapolis, Minnesota. She attended the College of St. Scholastica, graduating in 2014 with a Bachelor of Science in Nursing, where she went on to work in the emergency department and intensive care units at 2 large volume trauma hospitals in Minnesota. And in 2021, she graduated from St. Catherine's University, obtaining her master's degree in nursing and becoming a board-certified adult geriatric nurse practitioner. As a student of St. Catherine's Doctor of Nursing Practice program, Kristin has worked hand in hand with local Amish community members, providing first aid education. She was a recipient of a grant from Community Giving, which provided the necessary funding for the first aid kits supplied to the community. And finally, she graduated with her Doctor of Nursing Practice in May 2022. So belated congratulations on all this work. And Kristin, I'm just going to turn it over to you now and share with us more about your work.
Great. Thank you so much. So I'm going to go like this. Let's see. There we go. Everybody can see the presentation at this point in time. Should be good to go. So we'll just kind of jump off from here. So I am using 2 different computers. So this should be interesting, but I think I'll make it work. So this presentation is looking at the implementation of first aid education and the necessary first aid supplies into Minnesota Amish community. So here in Minnesota. Okay. So again, like I said, I just want to take the opportunity to thank everybody with the Apasa Cafe to have me come in and talk about this. It was a huge project that I never anticipated would ever quite get to this level. I had just anticipated I would be doing this project for school, and that was going to be kind of the end of things. So it is very much an honor to have been asked to be present here today. So Just a little bit about me, first of all. I was born and raised here in Minnesota. Shortly after graduating high school, I left for the military, and then that's where I spent the next 9 years of my life, was working active duty Navy, having absolutely nothing to do with the medical community. I actually worked in the aviation field. But I had a really great opportunity. I lived abroad for a number of years in Europe, where I lived in Spain, and then came back to the United States, where I spent the next six and a half years living in California on the West Coast. And then finally in 2010, I decided to separate from the military, had made the decision to go to nursing school, and that's where I came back home to Minnesota and attended nursing school. So I did graduate with my bachelor's of science in 2014, where I started working in one of the major local hospitals at that time in the emergency department. And throughout this presentation, you'll see areas where that emergency department expertise kind of comes in, and that's where I spent my career, was in the emergency room. I do have some intensive care experience, mostly around COVID timeframe, when we needed to really pile our resources together. But in 2020, right in the heart of COVID, is when I started my quest for my graduate program. And 2021, I graduated with my nurse practitioner degree, so my master's degree in nursing. And then I just most recently graduated. Corey, I think it was probably a typo on my end. I graduated with my doctoral degree in 2023, so just even a handful of months ago. And now don't work in any field in public health really with the Amish anymore. I do miss that community of people, but work with the geriatric community here, serving the older adult population, and work specifically with them. So what feels like a whole bunch of life experience. I have absolutely no previous experience working with the Amish, any exposure with the Amish prior to working on this project. So a funny little story was, until this project had started, my actual only experience with the Amish was my husband and I were in, I'm going to mispronounce this, Lancaster, Pennsylvania, visiting some family members, and saw a horse and buggy on the side of the road. Also in Minnesota, there is a furniture store called the Amish Furniture Store that I drive by. I don't actually know if that store is run by the Amish, has Amish working for them, or contains any actual Amish furniture, but that's the name of the store. So that's kind of how I started this entire project off. That was my base of knowledge right there. So very, very little, minimal amount of knowledge. The scope of this project, or the timeline of this project, is going to be looking at late 2021 into early 2023 timeframe. So this slide right here is just a really crude breakdown of some of the steps that went into the kind of creation, the development, execution of how the project transpired from the beginning to end. And then what I'm going to hope to do is kind of hit on each one of these steps, interject with a couple of the lessons I learned during this project overall. So the first challenge that I experienced was, again, my complete and total lack of knowledge about really anything having to do with the Amish or the Amish culture. I didn't even know that Minnesota had an Amish community. And so in the write-up at the very beginning, if people happen to see it, there were a couple of articles that I had annotated, a book as well, that really helped kind of establish some of that baseline knowledge that I really needed to be able to start that integration into the Amish community as a whole. And so that was a huge jumping off starting point for me. And the other thing that I would just kind of like to make sure I set the basis for is the fact that this project was a huge collaborative effort between myself and several other entities. you'll hear me intermix I and we, I think, a lot during this presentation, and that's because of that collaborative effort. I know overall I wasn't able to make as much of an impact, where I would not have been able to make as much of an impact with the Amish community without the help of these outside resources. So Kanabec County, who's represented here on video today, the Minnesota Amish Healthcare Program also represented on video today, but then also the nursing program from one of the local community colleges was also a huge key player in kind of how everything came together overall. So as I began reading about the Amish, I needed to not only learn about the Amish, but then the Amish specific to Minnesota. So this map here is a representation of the Amish population in 2021. And it's taken from the Amish Studies website. And you'll see that in Minnesota, the population or estimated population was approximately 5,000 Amish at that time. And it's important to also get an idea of where Kanabec County sits within the state of Minnesota. So it's a little hard to see. There's an arrow on what would be the east side of Minnesota that points to Kanabec County. So you're looking at central eastern Minnesota for where Kanabec County sits as a whole. And so if you're looking at the state of Minnesota as a whole, the Amish community is 4,000 people. There were roughly 130 members of the Amish community in Kanabec County. And then as a kind of a way to look at it, Kanabec County is made up of about 16,000 people. So a very small percentage of a relatively small county within the state of Minnesota. And then just for reference, if you go just below the arrows, to the south, you'll see two small counties that are in red. Those are Minneapolis and St. Paul, so capital areas. The majority of the population would live in those two areas. So definitely outside of that major metropolitan area. So as I'm sure many of the individuals on this talk today are aware, the Amish have been historically hesitant to accept, adopt, implement the kind of Western healthcare ways. One of the most disturbing stories I learned was that there have been documented incidences where children have been taken away from family members because of Amish healthcare viewpoints when it comes to medical, and families being deemed like not suited to care for their children, not being able to make these complex medical decisions. And so there's been a lot of trauma around that, and that's led to kind of a lack of trust, a breakdown in relationships between the Amish and the Western healthcare system as a whole. It's also important to recognize that there's a strong preference for providing care for family members within their homes, staying within their homes, staying within their community, and really providing that centralized community care versus seeking external care in a hospital. And then utilization of alternative methods of treatment, or complementary medicine, sometimes as it's known as. So looking at the use of chiropractors, supplementation, so vitamins, minerals, essential oils, other natural remedies is a high priority for kind of the Amish population from what I have learned. And then it's also important to recognize that there's often low health literacy rates. There's limited science education. There's a lack of insurance, cultural differences, poverty, rural living. All of this makes access to medical treatment difficult and expensive. So conservative values, strong connections with God, these are all major things that I had to learn about to be able to kind of come into the Amish community with a better understanding of who they are as a whole, where I fit into that relationship, and then trying to find a way to be able to make those two major cultural differences come together. So establishing connections, this was absolutely critical. I worked with the local public health nurse. She helped bring me out into the community. to meet the families. She had already had developed relationships with a lot of the families. They knew who she was. And so without that connection, it would have been extremely difficult for me to even get to know people. I don't think it would have been well responded for just having a stranger knock on a door and say, "Hi, I'm here to, implement a project into your community." So Autumn was really critical in being able to, both Autumn and Mary were critical in being able to kind of make and start that early connection with people. The other great thing is that because Mary has worked with students before and bringing the students into the Amish community, working with students wasn't a new concept. So the Amish in Kanabec have done a couple of different projects with different students. So that was something not new, which was also helpful. It wasn't a completely foreign relationship. I found that developing trust and finding how to build a rapport with people fell on allowing the opportunity to have kind of an open dialogue. So allowing the Amish to ask questions about me and what I was doing, but then also making it okay for me to be able to ask questions of the Amish, and have that open communication, that open dialogue was kind of a foundational step in building that trusting relationship. And then having observations, but observations without judgment. So I quickly recognized that there's some drastically different cultural differences between myself and the Amish community. But recognizing that there's no 100% right way of doing things. That was really important. Recognizing if I was going to be able to make a difference in this community, it was going to be important that I was viewed as a partner, a collaborative partner in this project, but not kind of a dictator or somebody that was going to come in and demand that ways of life change, or the way that they're doing things is wrong, or really impose that Western healthcare value onto them. That was not going to be an effective way to make change. So realizing that I'm coming into their community, not the other way around. So there we go. Had a couple of aha moments as this project was going on. And so while getting to know the Amish community, early portion of my project was to do a general needs assessment, figure out how best to help them. What did they need? Was there a way that I could identify something to be able to, implement into the community to kind of start this project off? And so one of the things that I saw was that there were families who have multiple children, big families. These families engage in manual labor, farming. There's a high incidence of trauma, injury, and those trauma incidences are actually pretty well studied in the Amish community as a whole, not specific to Minnesota, but there's actually a lot of really in-depth articles about Amish and trauma when it comes to medicine. So I did start to notice that there was no centralized area, or very rarely was there a centralized area where first aid kits or first aid supplies were held. And so what I started hearing was like, "Oh yeah, sure, I have a thermometer. It's around, I can find it," or "I'm not 100% sure where it is, but we do have one. We do have one. It's around here somewhere," if you asked about maybe gauze or Band-Aids. And so I started to kind of pick up on those key phrases that, like, I know it's here, but it'll take me a minute to find it, was one of the things that I, like I said, had started to pick up on. And so, like I had mentioned before, my personal background is in emergency medicine. So I've worked at 2 level 1 trauma centers, where these are the facilities where the highest trauma, most critical injury, serious injury, critically ill patients come. And I also have a huge passion for education and teaching, both surrounding medicine, but then also looking at how to improve outcomes for patients, you know, at the time of discharge. That was one of the things that I really loved working in my nursing job, was that education. So major metropolitan hospitals. So this is looking at social determinants of health. So looking and taking my time at working in those major metropolitan hospitals, I found that I was often working with patients who lacked resources. They didn't have the healthcare resources they needed. Perhaps there was a language barrier that was going on. They had had personal traumas that they had been exposed to. They didn't understand how to navigate the healthcare system. They had been dealing with or exposed to systemic racism, systemic classism that had, you know, that's apparent in our everyday lives here. Low health literacy, again, that lack of access, misinformation. These social determinants of health all lead to poor outcomes. They lead to high hospitalization rates, and then the high cost of care that's associated with that. Because a lot of times the emergency room then is the access point for healthcare, and emergency room care is the most expensive pathway of care that's available. So I really wanted to improve kind of that overall health system. How do we keep healthcare costs low? How do we implement simple measures into a community to prevent those emergency room hospitalizations? And then how do we just improve knowledge in general, education? So a funny little quick anecdote kind of comes back to having that open dialogue with people. As I was doing my needs assessment, I was in the house of one of the local Amish women. We were talking about some common first aid supplies that they have within their home. And I knew that natural remedies was important, that, you know, reduction of waste was important, resources, that type of thing. And I was so excited because I had found a recipe for how to make a reusable ice pack. So some Dawn dish soap, a little bit of reusable or rubbing alcohol, a sponge, and a like a Ziploc bag. And I was asking, I said, well, would a tool like an ice pack be, you know, helpful or handy to have on hand? Was telling her that I was so excited because I had found this reusable recipe. And it might be a really nice solution, since you can keep it, you know, right in your kitchen. You can keep it in the freezer and it would be available if you needed it. Yep. That was one of those moments, a humbling moment, where I quickly looked around and said, there is no freezer. This is a community that doesn't have electricity. And so that was, like I said, one of those aha moments where I kind of had to be open and then re-navigate my mindset to, okay, this isn't going to work. Now, where can I take this? So the good news is the Amish woman and I, we had a great laugh about it. We laughed, we moved on a little bit. But like I said, it helped continue that conversation of how do you provide medical care with those limitations within your community. So it's really one of the times where the Amish community as a whole helped to teach me and reframe my mindset. So after I was able to kind of identify a focus, the next step was going to be to create a prototype. And so that's where that budget comes in. How are we going to start paying for this? Because while you're in a doctoral program, you can come up with fantastic ideas. The funding is not always there. And the major difference between myself and the way that my project went versus a lot of my cohorted students was that they were working in a hospital system where budget wasn't something that they necessarily had to think about. They were working within the confines of the hospital budget, where with this project, because we were really building it from the ground up, we didn't have the money. So Mary introduced me to a community grant that was identified as a potential source for funding. So we were awarded $3,000 overall. And that was enough money to be able to put together a total of 12 first aid kits. 15 of them went out to family members. There was one that went to the school, and then there were 4 extras that we have around for kind of members as they move in. So with that, like I said, the 20 kits were created, and then there were some extra supplies that were going to be available for restock and resupply. So some of the items that we put into the first aid kit were different size gauzes, dressings and bandages, gauze rolls. We did put in 2 different medicinal items. So looking at a triple antibiotic, a Neosporin, and a hydrocortisone cream for things like bee stings and rashes and itches. We put in cotton tipped swabs or Q-tips. There was a mini notebook that went in there for people to be able to take notes or annotate if they, had something they needed to write down. I wanted them to be able to have paper available. A medical grade shears, so something that could cut through leather, it could cut through thick clothing, denim, not just a regular scissors you would buy from the store. There was a pen light, otherwise known as like a little mini flashlight. We did include in everybody's kit a pulse oximeter, tweezers, ace wrap, or those stretchy kind of flesh colored bandages. There was a thermometer, some hand sanitizer, and gloves that were also included. And then one of the other things that I did was I was finding that in these families that had young children, the women and the mothers were open to treating things like fever with Tylenol. But as I proceeded through this project, I also I had a baby. And so I found as a woman with a young child, a baby, I had a panic moment one night. My kid had a really high fever, and I couldn't do the math on how to dose Tylenol to save my life. Here I am, a 10-year, ER nurse, and I couldn't figure out how to calculate Tylenol. And I realized that this must be a problem, not just on my scale, but on a bigger scale. So I created pediatric dosing charts for Tylenol and ibuprofen that I laminated, and then it's usually done on a weight base. So making sure that, the proper Tylenol dosing or the ibuprofen dosing was then matched with the proper weight. There was a recipe for saline solution, and then there was a recipe for a soap suds enema, because I found that a lot of Amish people tend to use enemas. So that was a teaching point for me. So those were some of the items that ended up going into the first aid kit. So in collaboration then with Kanabec County Public Health, we identified 5 areas of teaching that we wanted to expand upon. So the Amish community in Kanabec County has the availability to be able to call into, we call it triage, but they call into Autumn and talk to Autumn and say, hey, this is a health problem that we're having. Maybe it's a breathing problem. Maybe it's somebody who fell down and, they have a wound. And so working with the public health team, we looked at kind of what those calls had been, some of the most common calls. And then we wanted to pair that with the items that we had stocked in the first aid kit to create a teaching plan. And so the topics for the teaching plan, we're looking at falls, infection treatments, so how to prevent infection, but then also if you have an infection, what can you do? We paired that with the importance of hand hygiene. We looked at respiratory complications, sprains, strains, and orthopedic injuries, and then also open wounds and bleeding. Those were the 5 topic points. There was a lot of crossover between some of the areas, but those were the areas that we wanted to focus in on and develop a teaching plan around. And the other thing that we wanted to do was then show how the first aid kit supplies could be included or best utilized to help treat those 5 areas. So Amish Education Day was an event that was held roughly once per month within Kanabec County Amish community. So it was an already established process. and practice that they had been doing. And what it was is it's an opportunity for the community as a whole to get together into one meeting place. So it helped with getting more people together to teach more people at once versus having to go around and talk to each individual family. So some previous topics that had been chosen by the community at large or by the public health team were things like a respiratory unit, where they talked about how the lungs worked. We looked at pneumonia or asthma, different tools that are used for the treatment of those. So like what an inhaler would look like, that type of thing. And because they were already being done on a relatively consistent basis, it was easy enough for me to just kind of hop in and jump on board with that already established process. So that made it a little bit easier for me to then introduce and implement my project overall. So there were a couple of things that the Amish Education Day also helped with, which was communication and technology, or kind of the lack thereof surrounding technology. So similar to my freezer refrigerator story, I didn't have power outlets to be able to just pop my computer up and pull up a PowerPoint presentation. So looking and reevaluating how I was going to be able to communicate with people. No email, no computers, no PowerPoint, no training demonstrations. I can't pull up a nice little video that explains things. So it was a big learning process on how can we work on expanding education within the confines and the limitations of technology. I dedicated about 2 months of our educational modules. So there were 2 separate months. There were 5 modules. We did 3 modules 1 month and 2 modules the second month. And this is where I paired with the nursing students from a local community college. So they came in and helped put together educational material, but then they also helped to present the educational material. So looking at that kind of lack of technology, how were we going to present education material to people? And we went back, for lack of a better term, kind of old school. We got trifold poster boards, and the students put together a presentation on a poster board. They may have cut out pictures. They could have implemented, what each individual device looked like. We included hands-on demonstrations. There were some question and answer sessions that went on. So the Amish could ask questions about how things work. They could ask questions about the kind of anatomy and physiology behind things. And then there were also newsletters that were printed off and made available to help with kind of that retention of information. So Amish Education Day was the huge kind of opportune time for us to really be able to implement that education into the community. So overall, if we're looking at some of the results that went on, I mean, I'm sure that's what everybody is, sitting on the edge of their seats about, wondering what overall this project showed. And so there was a survey that went out about 3 months after that initial distribution of the first aid kits, evaluating the supplies that had been given out. I wanted to know how confident people felt in being able to perform the skills that they had learned in Amish Education Day. And so the surveys were mailed out. They were also in-person interviews that were done. So every person who received a first aid kit had a follow-up in one form or another. And actually, Mary and I went and talked to all 15 families who had received a first aid kit. they were interviewed in person. So everybody within the community was, we had the opportunity to talk to everybody within that community. And so I'm happy to report we received super amazing feedback. So even in that short amount of time, most families had used something. It may have been something as simple as a Band-Aid or the tape. But one mother reported she used her pen light to check the pupils of her child. I think they fell off a counter or a table of some sort and struck their head. And so she used the pen light to look into check for, the baby's pupils. And another person talked about, the gauze pads, having them on hand. Their spouse had gone out into the woods and had a pretty significant cut to their forehead. I was super excited about the ice packs. We put in disposable ice packs, but because it was the middle of winter, those had not been utilized very often. I think there were 1 or 2 that they had used at school, but most people had just used the ice or snow that was from outside. The supplies for bleeding were probably the biggest thing that had been utilized. But the most positive thing that I took away from kind of that 3-month follow-up survey was the fact that I heard over and over and over, I know where to go if something happens. I know where to get the kit. And so during our in-person visits, a lot of times we would see people go to maybe a cabinet in the kitchen or into the hallway or, wherever they kept their first aid kit, be able to retrieve it and then bring it to us and show us like, hey, here it is, I found it. This was also an opportunity for us, or for myself, to learn where we needed to improve. And we got a lot of requests for Amish remedies to be included in our first aid kits. And so that was one of those moments where it's like, oh, okay, let's see what else we can, do for the next cycle or the next time that this comes around. And they wanted more hands-on opportunities. They were intrigued. They were excited about the supplies that they had received and wanted to know how to use them and continue to use them. So some of the next steps moving forward, the recognition that sustainability is absolutely a huge factor in this. How do we keep this going? All too long in kind of the science world, from what I've seen, we make a change, we make an implementation, and then 6 months later, nobody's doing it anymore. There's very little follow through, and I did not want this project to fall way to that. There was a lot of time, a lot of energy, and a lot of thought that went into this, and I wanted this to be a sustainable thing where families wanted to continue to use the first aid kits and would go back and use those supplies, even if they needed restocking. This was a huge thing. So I didn't want it to just sit and collect dust on a shelf. That wasn't going to sit well for me. So like I said, during our post-intervention surveys, that 3-month follow-up survey, identifying that Amish remedies were really important. So there were 2 that were mentioned kind of over and over, Super Tonic and a draw salve. And there was a little bit of remaining grant money. So we commissioned 2 of the local Amish women to make those salves. And then we were able to implement that and incorporate them into the community so that the community could incorporate those salves into their first aid kits. The remaining extra supplies were made available to the Amish community for the continued restocking of anything that they were to use. It was really important to me that we attempted to keep those replacement supplies kind of at a no cost or a really low cost to the community. And any further supplies after that would need to be available locally. A Walmart, a Dollar General, a local grocery store, Amazon.com wasn't going to be a viable option. So, and then identifying the ongoing education that was going to need to occur. And so it's been talked about, how do we continue to provide that education and what does that look like? A lot of that will happen kind of outside of the scope or the timeline of this project. But knowing that there needs to be that continual education to keep people up to date with how to best use those supplies, make sure that people's training is ongoing. So the results of my research were turned over to the Amish Healthcare Program, Kanabec County Public Health, and hopefully those two groups of people will then continue to kind of implement that or sustain that within the community. Again, outside of my project timelines, but that's one of the ways that it was identified on how to keep this going. So, oops, there we go. So a couple of the takeaways throughout my entire project, and Mary can attest to this, I continued to talk about this collaborative effort between Amish and Western healthcare. And the gear cog is really my favorite visual representation, where the Amish and the Western culture come together and they work cohesively and collaboratively with one another. They learn from one another, they exchange ideas with one another. And despite those differences in values and beliefs, we need to come together in that kind of gear motion to provide the best outcomes for everybody. So open communication being a huge factor. The lack of technology was a curse, but it also was a blessing. So in the current world, computers, emails, video meetings, text messaging, electronic forms of communication are the normative way of doing things. This was not the case with this project. It forced myself to slow down, to talk to people, to have that communication, that in-person dialogue, because it was either going to be in person or it was going to be via snail mail, aka the postal service, to have some form of communication. So it was definitely, that lack of technology was definitely an area where I had to meet the Amish where they were and not expect them to just hop on a computer, because that was not going to happen. So it was apparent during educational day presentations, when the students put that on, again, that technology, we had to use those trifold poster boards. There wasn't going to be a PowerPoint presentation. But I think overall, it helped with the sustainability of this project. The community can continue to go back and utilize those poster boards. They can go back and see, they have that visual reference for people. And like I said, that ongoing education. So that was great. The only other thing that I identified was it's really unknown. I know one of the other APASA talks was about Pennsylvania Dutch and German language. I don't know, honestly, if there were any language barriers that limited understanding or the transmission of knowledge. I recognize that Amish culture, their first language is not English, but there wasn't anything that was brought to my attention as a reason to, not move forward with anything. So it was important during the duration of this project that the Amish viewed me really as a partner. I never wanted to be perceived as the person forcing my ideas on anybody. I wanted everybody to kind of come together and learn from one another. So my time working as a nurse, it kind of gave me the insight into the fact that when there's that attitude of my way's the best way, my way's the best way, learning is inhibited. People shut off, they become defensive, they're not receptive to learning any new information. And it's also incredibly naive of me to think that just because I was trained in a Western style medicine, that's the ultimate way to go. So it was important that I remained respectful, open to communication, open to the ideas that the Amish way of doing things works for them, and it has been working for them. So I really think that because that was one of the mindsets that I came in with, it helped kind of build that trust. I would love to be able to say, this is how you develop trust within the Amish community, and, provide you with a checklist. Lord knows I wanted one as I was moving through this project, to be able to type into a search engine how to develop trusting relationships with Amish. But there weren't any literary articles that I could find. There wasn't a whole lot of guidance that was provided. There wasn't a whole lot of insight. Part of that is because the Amish are just not really well studied, especially in the instance where somebody comes into the Amish community. So a personalized approach is kind of what I was seeing in a lot of the research, a lot of the journals, and needing to tailor your techniques to each situation. Each scenario is going to be a little different. And while those statements were not very helpful, ultimately, myself and the other members of this project were able to kind of find what that fine balance was. And I think it's important that we all recognize the fact that working with the Amish community is a little different if you're in Pennsylvania. It's a little different if you're in Indiana. It's a little different if you're in Kansas. It's a little different if you're in Minnesota. And even in Minnesota, it's a little different with each community that you go to. And so the collaborative effort, the building of trust, the blending of cultures is all really personalized and tailored towards each community that you're working with. So that was probably the biggest takeaway that I had. The opportunity to learn during this was how to work on my communication, both with the Amish, but then I was able to take some of those lessons and apply them even into my everyday practice that I have. So just a couple of resources and references, and then that's all that I have.